Steve Pisano, PRMA San Antonio. We're going over some commonly asked questions. Patients want to know about our flap procedures and how the mastectomy is done and how that all comes together. One commonly asked question is, if we're going to save the nipple and areola, what will the sensation be like after the mastectomy and reconstruction? Well, the good news is when you save the nipple and areola, you're going to have some sensation to that area. It may not be as good, as exquisite, quite normal, but certainly better than if the nipple and the areola is removed. And with that sensation that you retain, the flap reconstruction, or implant for that matter, but especially for a flap reconstruction, feels more like part of you. Now, several things determine the degree of sensation that you have in the nipple and areola. One is how the mastectomy is done, because the general surgeon or oncologic surgeon has to get the breast tissue out from under that skin envelope, but leave it thick enough that we still have some nerve supply, certainly blood supply as well. The surgeons that we work with here in San Antonio, with whom we do nipple-sparing mastectomies, are good at leaving that nipple areola thick enough that it survives, number one, and number two, has good sensation. So that technique of how the mastectomy is done really helps determine the degree of sensation. Another thing that helps determine the amount of sensation is where the incision is for the mastectomy, because there's lots of options of where that can go. The best option is to have the incision in the fold under the breast. But in order to do that, the breast size can't be too big. A cup, B cup, maybe a small C. But a larger breast, the incision is better placed out to the side or in a vertical because that makes the mastectomy process easier for the general surgeon to accomplish his or her task. So the best situation is a patient who has maybe a little bit smaller breast where the incision is under the fold. And then from our end, on the reconstruction side, one of the things that we do is we hook up a sensory nerve to whatever tissue it is we're moving to do the reconstruction. So most commonly, the DIEP flap, or we say DIEP flap. With that, we can hook up a sensory nerve, and that helps bring sensation to the actual tissue transplant, the flap that we move, say, from your tummy. So together with the nipple-sparing mastectomy and with the hookup of that sensory nerve to the flap, we've kind of doubled up on the sensation issue with the reconstruction so that the whole reconstructed breast feels like part of you. So I hope that helps clear up that issue.